Good morning, everyone, and my viewers. I wish to welcome you back to our tutorial once again. Um, this is a new day and a new moment for our training. You are welcome. Welcome to Fisher Pulse, your greatest resource for basic life support training. And whether you are a healthcare professional or first responder, or you are just a concerned citizen who wants to be prepared in emergency, this channel equips you with essential CPR, AED, and first aid skills. And with this, you are rest assured that you can become very relevant to the society and also to mankind. You will be a solution to problems, to various victims, within our environment and our society. So I want to welcome you back to our today's video and tutorial. So thank you. And also, please, I want to appeal to you to subscribe now, and let's save lives together. In the course of the video, if what we are doing interests you, just look down, you will see the subscription button. Just click on that button to subscribe. You can like and share the video so that other persons can look at it and also make good use of it. Thank you very much. I once again welcome you to today's tutorial. Okay, today we'll be looking at cardiopulmonary resuscitation techniques. Yesterday we were able to look at the introduction to basic life support, and we, in the course of our training yesterday, we were able to have a holistic look at the components of BLS, which are CPR, AED, and of course airway management. Okay, so we did some justice to it yesterday, although I told us that we're going to be taking it one after the other to see how we can, do a thorough job on it, so that whoever that is coming to our channel will be rest assured that it's going to be a great resource for the person. You could just come in here and you sit quietly and listen to this video and learn a lot. So today we'll be taking on CPR, cardiopulmonary resuscitation technique. So we'll be doing a great job on the CPR techniques, on how to handle a victim, with CPR, how to administer CPR on any victim that is under attack. And I remember I told us that CPR technique is a life-saving technique used in any emergency that has to do with cardiac arrest, or drowning or suffocation. Someone who was drowning and was taken out, and we need to resuscitate the person. So the best thing to do, especially when the person is unconscious, is to administer CPR. And it usually occurs when the heart has been certified, paused. If the heart has been paused and there is need for the heart to be, awoken again, so you administer CPR. Okay, so it involves combination of chest compression and, of course, rescue breath. I told us about rescue breath yesterday, and I also, told us, the ranges, both for adults, children, and infants. And I told us about what is called compression ventilation ratio, which is the ratio between the compression times and also the rescue breath times. Okay, so and we were able to learn or establish yesterday that during compression, just as the normal heart will beat for 100 to 120 times in a minute, it's expected that during rescue time or moment, the first responder or the person who is undertaking the rescue activity on the victim should also understand the number of times that CPR has to be done, and also the depth, right? So when you have a situation that calls for CPR application, you should know that there is a number of counts that has to be undertaken. Well, in this case, the 100 to 120, time compression, and then the rescue breath that follows it. Okay, so and we also established yesterday that for a life to, or for the system to function normally, or to still have life in it, there is a tendency for oxygen and the blood to work together. And we're able to see that when the brain is starved of oxygen and the blood, it will begin to deteriorate, and especially when you allow the victim to stay up to 10 minutes, right? So between 4 to 6 minutes, the victim can still be, helped, but then the brain begins to, deteriorate once it exceeds 6 minutes, getting to 10 minutes. So it is important that whenever a victim is sighted, the best thing to do at that moment is to begin to administer CPR so that the organs will not die, especially the heart and the brain. So when the heart is still okay, there is still enough blood available in the heart that can easily go out and circulate around the system and come back to the heart. Of course, feed the other organs, the kidney, the liver, and other areas in the system, and then back to the brain. Then the victim can actually be said to still be sound and okay. All right, we will be looking at the objectives of CPR training. The objective, why are we talking about this CPR this way? Why do we need CPR? Why do the society need CPR? Why do we need first responders? Why do we need healthcare professionals, healthcare practitioners to understand the need for them to get this skill, to themselves, so that when the need arises, it has to be, to be applied. So the first objectives for us learning this CPR is to understand the importance of early CPR in increasing survival rates. I told us yesterday that when we see a victim that is under attack, the first thing we should do is to apply CPR, because early detection, can save that life, can increase the survival rates of that victim. But when we, begin to take pictures and they post, videos, you are increasing the death rate of that person. So applying CPR increases the survival rates of the person. The second one is performing high quality chest compression on adults, children, and infants. The second objective is to learn to perform accurate compression rates, accurate and quality chest compression on adults, children, and infants. I told us about the variations when it comes to compression, rates, the variation, and also the how the compression has to be done, both the adults, children, and infants. They varies. They are not the same, and also the number of hands that should be applied are not the same. When it comes to adults, you need 2 hands. Children need 1 hand. Then the infants are those ranging from 0 to 12 months. What they need are 2 fingers. 2 fingers just to do so. We're going to look at that in the course as we progress. Now, the next one is to deliver effective rescue breath. The objective is to teach us, for us to learn how to deliver effective rescue breath. How do we do it? How do we administer this breath? How do we deliver it? And how many times are we supposed to do that? And when should we do that? So that is what we need to know in this training about CPR. Then another one is identify when and how to use AED, automated external defibrillator. All right. So we need to also understand how to use AED and when it has to be applied. When should we apply AED? You don't just see a victim, that is under attack and you begin to apply AED. No, there has to be first of all CPR that has to be administered. When you notice that CPR, is not, forth-bringing, results, then you have to switch to AED. So the process of understanding, the objectives rather of this training of CPR training will help you to know how and when to administer AED. Then the last one is apply modification for different ages, which I have just mentioned. So the variation is what we should also learn. How many times are we supposed to give rescue breath, and how many times are we supposed to do compression on the various ages? Right. So now we also are going to the next phase of this tutorial is on the CPR process. CPR process. How do we do it? What are the methods? What are the methodologies? Of this CPR. Now, the first one, the step 1, these are step-by-step methods of administering CPR. The step 1 is assess the situation and ensure safety. When you see a victim, that is under attack, you need to first of all check around and be sure that the environment is safe for you and safe for the victim. If the environment is not safe for you, especially, you have to call for help. Call for first responders. Make a call for EMT to arrive fast to take over from you if you are sure that the place is not very safe. So check if the scene is safe for both the rescuer and the victim. Then the second one is to tap the victim and shout, "Are you okay?" When you see a victim that has collapsed and the victim is there struggling. Sometimes the struggle you see that goes on within the systems, within the victim, could be how the quick mode at which the life wants to leave the victim. So when you see that happening, all you need to do is to tap the victim and shout at the victim to be sure that the victim is either unconscious or conscious. If the victim is still conscious, then the victim can answer. Otherwise, the victim may not answer. Now, when you've tapped and shouted, "Are you okay?" then you are trying to check for responsiveness. Okay? Then after that, if the victim is unresponsive and not breathing normally, then activate emergency. Especially when you saw the victim, still just entering into this attack scenario, right? So you've tagged the victim is not, responsive. Then all you need to do immediately is to call EMT, and after calling EMT, you begin to, apply CPR immediately. Right, so that is the first step. Then the second step is begin chest compression, just like I mentioned right now. So after remember, the first one is you make sure that the environment is safe for you and the victim, and then you begin to tap and shout at the victim to be sure that the victim is okay. If there is no response, then call EMT immediately. When you call EMT immediately and be sure that the EMT has picked and is on their way, then you commence compression, commence CPR. You commence CPR. Okay, so the CPR is to ensure that there is blood circulation. You need to maintain circulation of both blood and air within, in and around the system, around the victim's system, so that the victim will not stop, will not die. Okay, especially when the heart has stopped beating. Okay, so you keep compressing, and keep compressing for the victim to keep receiving blood and the air. So now before you start the compression, you need to first of all check the position of the victim. Okay, if the victim is not positioned well, you need to allow the victim to lie down flat, undress the victim, remove the clothes that the victim is wearing, undress the victim, especially the upper parts. Make sure that the victim is undressed. Now you begin to apply CPR. Now, the application of the CPR has method. You don't just begin to apply, the compression. There's a position where the compression has to be done, and there are also ways how the hands is to be placed for the victim to receive, effective compression. So the first thing you need to do is you place the victim on a flat, firm surface. Flat, firm surface. They allow the victim to lie down and facing up. When the victim is facing up, then you kneel beside the victim. Kneel beside the victim's chest, and now place your hand effectively around the sternum region at the lower side of the chest. Okay, where you have the sternum. When we come up with the practical, I'm going to show us the various positions and the various parts which I just mentioned now, and how you have to place your hands in order to achieve effective compression. Okay, so you place your hand there, you place the heel of your hand is here. Place the heel of your hand there, and now lock it up with the other hand. You are going to use this heel to do the compression. You lock your hand like this and stand. You are kneeling beside the victim's chest. You are doing the compression, and make sure that your hands are stretched out well. You don't bend it. You use the weight of your body to apply the compression. Apply the compression and be sure that you are establishing the correct depth. And the correct depth. In the course of this study, I will tell us how much depth that we're supposed to to apply. Okay, so place the other hands on top and interlock the fingers, just like what I have told us. This is the first heel, and then you lock the other hand like this, and you place it, and you do your compression. So now compression depth and rates varies, like I told us. On adults, you need to do at least 2 inches, which is about 5 cm. 2 inches. For children between the ages of 1 to 8, you do 2 inches. You do depth of 2 inches. Okay, you do depth of 2 inches. Then for infants, you do about 1.5 inches deep, the depth. So the compression rate, like I've said earlier, is about 100 to 120 times per minute. 100 to 120 compression per minute, same as the bit of staying alive. There's a rhythm that when you are doing it, to show you that you are achieving the correct depth, you do staying alive, staying alive, staying alive, staying alive. That is what plays in your mind as you are actually as you are administering the CPR. Okay, so when you do that, the staying will give you the correct depth, and as you allow the heart to recoil, the staying alive brings out the heart back to you. So like I said, allow full chest recoil after the compression. So you continue with that compression uninterruptedly until EMT arrives. Now, the third step is to give rescue breath. Remember, I've told us, you see the victim. The first step is see the victim and be sure that the victim is safe and you too are safe. After you've done that, if the victim is not safe, please call the EMT. If you are not safe and the victim is not safe, please call the EMT. But if you are okay with the victim and the victim is safe, you are safe, please check the victim, whether the victim is still responsive, by tapping the victim and shouting, "Are you okay?" If the victim didn't respond, then you need to now place a call on EMT for EMT to come. As the EMT is coming, now resume CPR. When you resume CPR, ensure the correct compression and also ensure the right depth is achieved. If these are not achieved, there won't be adequate blood circulation to the brain and back to the heart, right? Because the heart has been naturally made in such a way that when the compression, it does complete depth. When the heart is beating, the heart compresses and opens, compresses and opens. So that compression is that 2 inches we are talking about, that 2 inches depth, and it does that compression, that pressure impact for like 100 to 120 minutes per minute. So 120 times per minute. So you need to also imitate what the heart does. So by doing your own artificial compression, like I told us, what you are doing is imitating the heart, and you are helping the victim to allocate enough blood around the system as the heart has stopped working. Right now, in the course of the rescue breath, you remember the victim is lying flat, facing up. You need to tilt the head up, and now the chin, you leave the chin open, try to drag the jaw down and open the mouth of the victim, and you apply rescue breath. I told us yesterday that when you are alone, you can do 30:2 compressions, ventilation ratio, 30 compressions and 2 rescue breath. The reason is because as you are pumping blood, you don't need to do 100 times before you apply oxygen, because the oxygen has to be working in tandem with the heart, because as my heart is beating, I am breathing. So there is this interrelationship between the heart and the blood and the oxygen, so that they must interact. If there is interaction is not there, it means it's only blood that is going to the heart, going to the brain, but oxygen is not going. So two of them must go. So in order not to starve the brain from oxygen rather, you need to do 30 compression and the 2 rescue breath. Okay, if there are 2 of you, especially in children, there has to be a minimum of 15 compression and the 2 rescue breath, 15 compression and 2 rescue breath. So in order for the victim to still sustain life in it. And how do you apply this rescue breath? You can use mouth-to-mouth breathing. You pinch the nose. When you pinch the nose of the victim, then since the mouth is open, you lock the mouth of the victim with your own mouth, and they just do 1 second breathing. You blow air into the victim. As you are blowing the air into the victim, you will notice that the heart is rising. The heart rises. Don't blow too much. Just do 1 second blowing of the air. Just like when you are breathing. If you notice, when you breathe in, the heart is very simple and very fragile. This chest. So when you breathe in, the heart, like a balloon, it will enlarge, and you see that the chest rises. So that is the inflation of the heart that rises it. So you don't need to use compressor rather to put air. No, if you do that, you blow up the person. You now help the person. You can help the person to die. So, but you just add a little air, and you now watch the victim, victim chest rise. If the victim chest does not rise, check the airway. Probably the airway is obstructed. So try and make sure that the airway is open, and now you apply the air. When you apply the air, the chest rises. You now begin the compression, and the victim will be relieved. Gradually you get the victim out of the situation. Okay, so I told us about adults and the children compression ventilation ratio is about 30:2. The 30 compression and 2 breath. Then infants, you have 15:2. 15 compressions if 2 rescuers are available. 15 compression and 2 breath are supposed to be there. When we are running the practical, I will show you everything. But get the information. The information is very important. Get it. If you have your book, please write everything down that I'm telling you. You could just take your notes, jot your note down. You can revisit this video over and over again to get the information, get the tutorial. What I'm telling you, get the items bit by bit in order not to make mistake, because a wrong application of what I'm telling you now will make you to even kill the victim when you are trying to see how to rescue the victim. Okay, another one is using an automated external defibrillator. So the other defibrillator is also another automatic, a compressor that can help you, to check, not really a compressor anyway, but it helps to check the heart. I told us yesterday when we were discussing, about, during introduction to BLS, I told us what the AED does. The AED, analyzes the heart rhythm. When the heart rhythm is not working as normal, as supposed to, the AED reanalyze the heart and reposition it and make it to start functioning well, so that the CPR can now come. Sometimes the AED does the jerking. Once it does the shocking, the victim can come back. The heart can be reactivated, and the heart will begin to function again. So there are 4 things that AED can do. The AED, it jacks, it applies the shock, to the heart. When it applies the shock to the heart, it analyzes the heart. That's number 2. Then after doing that, the heart begins to recover itself, and after that, the heart can now begin to pump. Now, for you to achieve that, there are methods we can use. The first one is to turn on the AED and follow voice prompt. I told you yesterday that the voice must be followed. If you don't follow the voice prompt, you make a mistake. Follow the voice prompt and then attach the electrode pads to the victims accurately. I told us yesterday, on the left side of your chest or under the breast, put the pad, and then on the right side of your chest, put the other pad here on top of your breast, just under the scapular bone. Put it here, and then you can now continue your analysis. Then stand clear while the AED analysis is the heart rhythm is done. Don't stay close to the person so that you don't alter the analysis. Because if you place your hand on that person and the shock is done, it will also shock you. You'll be shocked, and the actual analysis may not be done. The analysis may not be correct. So that is why you'll be told to stay clear. Once you have done that, you have placed the whole thing and then on it, and you are following the prompt and doing what the AED device asks you to do, just stay clear and allow the device to do, its work. Now, deliver a shock if prompted. If prompted, deliver a shock. Immediately after that, you can now resume your CPR. Now we have CPR modification for different ages. I have said that, and I have also mentioned, part of we have age variations or age groups. We have the adults, the children or child between age 1 to 8, and we have infants from age 0 to 12 months. And the compression depth I told us is about 2, at least for adults, at least 2 inches. The compression depth is 2 inches at least. And then for child, it's about 2 inches. You don't go beyond 2 inches. You don't go beyond 2 inches. For adults, you can go beyond 2 inches, but for children, you don't go beyond, so you don't collapse, the heart, okay, or the chest. You don't collapse it. Then for infants, it's about 1.5, inches depth. Now, hand position, I told us you use 2 hands for adults. You place the heel, this is the heel, and then you lock it up like this and begin your compression. But for children, it's either you use 1 hand, depending on the age and also the strength of the person involved. If the person there are some children that looks stronger than the other. So if the child is looking stronger and has a stronger bone, you can now use 2 hands, but not too strong. Don't apply the whole of your body on the person so that you don't collapse the chest. Be very careful how you apply the compression. Then for infants, you use 2 fingers. Use 2 fingers because remember the infants, they are still fragile. So use 2 fingers to do that. And compression breath ratio for adults is 30:2, and for child 30:2, and then for infants rather, is 15:2. Okay, for 2 rescuers. But for 1 rescuer, you can still go for 30:2. And now when you want to do rescue breathing, for adults, you do mouth to mouth, or you can use what you call a mask pad. Okay, you use mask, and when you put mask on the mouth of the victim, there is a supply of air. So you press and deliver air. So for adults, you can use mouth to mouth or mask. Then for child, you can use mouth to mouth or mask. Then for children, you use mouth to mouth or the entire nose. You put the whole of your mouth on both the mouth, seal up both the mouth and the nose. Remember, as you are applying the breathing, always lock the nose. Don't allow them, because if you don't lock the nose, as you are applying it, it's coming out through the nose. Okay, lock the nose and then apply that. Now there are common mistakes you need to avoid. Okay, this actually is going to be somehow round up our tutorial today. Common mistakes you need to avoid. Number 1 is not pushing hard or fast enough. I told us, don't compress fast enough. The heart has a rate at which it beats. It does not beat. When the heart is beating too fast, then it means something is wrong. Okay, something is wrong. There is high blood pressure. The pressure of the blood is high, so the heart is beating high like that. So there has to be a moderate beating. The heart has the way it beats. That is why it does not beat beyond 120 times per minute. Any heart that beats beyond 120 times per minute has a problem. So, and the person has to be checked. So you have to maintain the normal push. Okay, do your 100 to 120 compression per minute. Then not allowing full chest recoil is a problem. Make sure that you allow full chest, let the chest rise completely between compression. As you compress, like I told us about the rhythm that plays in your mind, staying alive. That's a full depth, and then you lift your hand up, the chest recoils. The chest must rise, that one is sure. So it recoils. Once it recoils, then you can now commence, until you have achieved the number of rate that you're supposed to achieve. These are the common mistakes you must avoid. Make sure that the chest recoils. Don't apply another CPR when the chest has not recoiled. Then improper placement of hand is also a problem. I told us the lower parts of the chest, around the sternum region. Don't place your hand here. It's not here. Place it around here, where you have sternum, okay, around here, and you apply. During our practical, I will show you everything, but just take note of these important point that I'm making. Then inadequate rescue breath is very important. I told us 30:2. Don't do 30:3. Don't do 30:4. If you apply too much breath, you will suffocate the person. Too much breath will kill the person. It will destroy the purpose. Okay. Now, yes, purpose will be defeated. So ensure the chest rises with each breath as you apply. Once the chest rises, please apply. If the chest has not risen, please don't stop applying. Make sure you remove if there's any obstruction, the chest cannot, because something is obstructing the air. Something is obstructing. So you need to remove what is obstructing the air and then commence your breathing. And now, don't stop too early. Don't stop CPR too early. Continue until help arrives or victim shows signs of life. The victim must show signs of life. Like I told us, this artificial, introduction of air, what you are mimicking, trying to mimic what the heart does. So you are artificially trying to do what the heart is doing. So you have to keep doing it. If in the course of doing it, you are experiencing fatigue, you have someone else beside you, please allow the person to also come in and apply CPR until EMT arrives. Please do that. If you get this information and understand it very well, I tell you, there are a lot of avoidable deaths around us. There are a lot of avoidable mistakes around us that could be, that could be overcome by, first of all, not certifying the person dead and taking the person to mortuary. Apply CPR. Engage this, rescue technique. Engage this skill. Okay, you'll be shocked at what might happen. In the end, before the rescue mission will come, you'll be shocked to see that the person is already recuperating and reviving itself. So, in conclusion, CPR is a critical skill that increases survival chances in cardiac emergency. I told us CPR is all about the heart. It becomes important when the heart stops. Once the heart stops, the body is beginning to deteriorate. The body begins to come down. So CPR revives everything. So it's a critical skill that increases the chances of survival of whichever victim that falls into such crisis. And high quality compression and effective rescue breath keep blood and oxygen circulating. Don't forget this. When you do effective compression and rescue breathing, it will make sure that the blood mixes well with the oxygen and takes it around the system, engaging the organs, especially the brain, and making sure that the brain is still functioning very well. The brain is still alive until EMT arrives. An AED can restore a normal heart rhythm and should be used as soon as possible. When you have seen that the CPR, is not giving you what you want, please switch over to AED if you know how to use it, the device AED. Just follow the prompt and apply the shock that can reanalyze the rhythm, the heart rhythm, and begin to restore the heart back to normalcy. Then you can now resume your CPR. And finally, regular training and practice ensure confidence and preparedness in emergency. See, what I'm doing is to give you what you want, the nuggets, the practical nugget that you need to make sure that lives are saved. If our society has this information, I tell you, people will not be dying anyhow. Today we have a lot of stress, people are going through a lot, and people need to be helped. And having this information, having this skill, having this technique will go a long way to make sure that that brother didn't die, that sister did not die, that person that has been certified dead, actually, will not die. Because you are there, you are like a lifesaver. You have the life that you can give to that person that has been seen, to be dead. You can give back life to that person. So you need this information. Get it, acquire it, keep it to yourself, and use it appropriately within our society. The government agencies and also health management agencies need to come in to foster cooperation especially with us, who are the trainers, to ensure that the society, gets this information. So I'm calling on the government, I'm calling on the health sectors, I'm calling on the corporate bodies, I'm calling on the schools, and all who will come across my voice or this video and hear my voice to please partner with us, partner with this opportunity, and make sure let's ensure that our society is safe, we are secured, and life does not just waste as a result of mistakes that usually will occur as a result of lack of information. The information is right here now, and we all have to acquire it. Thank you very much. Thank you for watching. If you found this video very helpful, please, I would like to look down, under this video, and you will see subscription button. Please press on the subscription and the subscribe to our YouTube channel. Our YouTube name is #FisherPulse. So just share and like this video so that persons who may be interested or who may need it, can see it and view it and also learn a lot from it. So please don't just keep it to yourself. Please like, share, and subscribe to our channel. We will be appreciative if you do that. So don't forget, like I said, to like and share. And then for more life-saving tutorials to come to you, because we're going to be releasing these nuggets on a regular basis. Okay, so, and also look at the comment section and drop questions. If you have any question, you have any comments, you have any observations, please drop it there, and let's keep learning together, and then keep learning together and apply what we have learned, so that the society can be more safe. So see you in the next video. Stay prepared and stay safe. Thank you very much, and God bless you.